process, and I've got my client Kazai, and we're just going to go through the whole process of screening assessments, because usually you want to make sure your client is healthy enough before you take them onto your workouts. So because there are quite a lot of risks that come with exercising before you know how healthy your client is. Like they might have blood pressure problems or heart problems, or maybe they might be overweight, but we've done all that process, so we're going to go on to our blood pressure. Usually you want your client to be nice and relaxed, both feet on the ground, and use their left arm and nothing in the way for the equipment to go over. So we'll start looking for their pulse. Their arm is nice and relaxed. You open their palm and you look for their pulse. Usually it's over a bone, and you just feel for their pulse, and you never use your thumb because it's got quite a lot of pressure, and you want to feel the pressure, the pulse. Alright, so usually you want just 2 or 3 fingers above where you found your pulse. Okay, and we're going to make sure this is nice and secure on, and it's not too tight. Make sure your valve is nice and closed, and you start pumping. Usually you want to pump between 160 and 200. Okay, so you're pumping, and you make sure your client is just relaxed as you're pumping, so it's not too tight and they're not showing any discomfort. Okay, and we've just over 160, and you now start releasing slowly, and you want to see where your first reading comes about. The top reading is usually just your, and it's about 110 first. Okay, so your blood pressure, the top reading is usually just for your blood pressure, how much your blood pressure going into your heart is, and the bottom reading is about 70 at the moment, which means it's very fit, and it's usually the heart muscle of the blood pumping out between your heartbeats. Okay, so that's our blood pressure, and usually you'll wait about 2 to 3 minutes before you do your next one, just to make sure you've got accurate measurements. Alright, so that's our blood pressure done. Okay, so like we mentioned earlier, your blood pressure will always have 2 readings, and for him we've done 110 over 70, and that's just what his blood pressure is going to be. Okay, so yeah, so that's the blood pressure done for now, and next we're going to go on to see our power, how you would do a power test. Okay, so we'll just go outside and come do it.